Welcome to the celebration of World Health Day 2025 with the Indian Medical Association Junior Doctors Network. We honor the tireless efforts of healthcare professionals worldwide. This year, on April 7, we mark the anniversary of the World Health Organization's founding in 1948 with a theme that resonates deeply with our collective aspirations for a healthier world, healthy beginnings, hopeful futures. This initiative emphasizes the critical role of early life health interventions, focusing on maternal and newborn health. It launches a year long global campaign to reduce preventable deaths and to improve health outcomes for women and infants. The campaign encourages governments, healthcare systems, and the concerned individuals of the families to intensify efforts against preventable maternal and newborn deaths, promote accessible and high quality healthcare, and to foster multi sectoral partnerships for better healthcare. We, the IMA members of the Andhra Pradesh, bring together expert talks from consultants across the state to discuss the aforementioned topic. These discussions address key issues such as maternal health, neonatal care, and early childhood development, highlighting challenges and actionable solutions to improve healthcare outcomes. Through this initiative, we aim to inspire collective action towards creating healthier beginnings for children and fostering hopeful futures for communities worldwide. Join us as we celebrate World Health Day and embark on this journey towards a brighter, healthier future for all.
Hello everyone, this is Dr. Sivaram Akkineni, consultant ENT surgeon from Vijayawada and currently the chairman of Indian Medical Association Junior Doctors Network, AP State. I am here to wish you all a happy World Health Day. As you all know, WHO comes up with a theme every year, and this year they have come up with a new theme, Healthy Beginnings and the Hopeful Futures. So our primary focus is on the maternal and newborn health care. So please join us in celebrating the World Health Day as we shine some light on the health of the well-being of mothers as well as the newborn kids. So please join us in raising the awareness and inspire some action and build a healthy future together. Thank you.
Good morning to everyone for joining us from across the state of Andhra Pradesh and perhaps beyond. I am Dr. Kiran Kumar Chitla and Joint Secretary IMA AP State and immediate past Chairman IMA Junior Doctors Network, Andhra Pradesh. It is an honor to welcome you all to the special session as we gather to unmark the important occasion observed every year on April 7th by World Health Organization. It's World Health Day 2025 today. Though we may be miles apart, today's virtual program brings us together in pursuit of a shared mission to promote better health for all. And in that spirit, it gives me great pleasure to introduce the organization at the heart of this initiative, the Indian Medical Association, the mother of all the medical fraternity associations. The Indian Medical Association is just not an NGO. It is a movement established in 1928. IMA is the largest representative body of doctors in India with more than 3 lakh members across the nation. It serves as a collective voice of the medical community advocating for medical ethics and public health, healthcare reforms. IMA bridges the gap between the public healthcare providers and policymakers. IMA works at multiple levels, not just to support doctors, but to uplift society at the large. To better service its goals, IMA developed various subdivisions, each focused on a specific aspect of healthcare and community service. The IMA Public Healthcare Division leads to awareness campaign on the topics like immunization, sanitation, and disease prevention. IMA College of General Practitioners, IMA CGP, IMA AMS, Academy of Medical Specialties, provides continuing education for doctors, ensuring they remain updated in every evolving field. We also have IMA Women Doctors Wing, empowering female medical professionals to take an leadership role, and IMA Junior Doctors Network and IMA Medical Students Network. In Junior Doctors Network, nurturing the next generation of healthcare leaders, and IMA MSN, wing will help to sparing the budding doctors. Though through our Gauchalo program, every IMA branch in the nation is adopting a village to provide a quality healthcare. IMA is doing various service activities like IMA blood donation camps, free medical camps, health awareness camps, and polio camps, and end TB program. These are the few important services done by IMA to the public. Today, we as Junior Doctors Network of IMA come together for the World Health Day. We align ourselves with the global vision of the WHO theme of 2025, healthy beginnings and a hopeful future. With the respect of maternal and neonatal health, the earliest moments of life shape the foundation of the healthy society. Every mother deserves safe childbirth and every newborn deserves a chance to thrive. Yet, too many lives are still lost to preventable causes. This must change. Investing in quality maternal health care, skilled both attendants and early neonatal interventions is just a medical, it's not a just medical treatment or management, it's a moral ethics. It ensures that no mother or child is left behind due to geographic or income or any other circumstances in our society. Today, let us reaffirm our commitment to nurturing life from its very first breath, because when we secure healthy beginnings, we unlock the hopeful, resilient futures for generations to come. Thank you, one and all. And once again, World Health Day wishes to all of you. Thank you.
Hi, I'm Dr. Karthik Tumala, consultant cardiologist, Finance Secretary IMAP State. Wishing you all Happy Health Day. WHO celebrates World Health Day on April 7th every year. This year the theme is Happy Beginning and Hopeful Futures. This is to create awareness among pregnant women and nurturing young kids and even neonatal period. We know that 3 lakh pregnant women die every year all across the globe. This awareness is predominantly to focus on women during this period, during pregnancy, to taking care of them, because mother is the pillar of the family. Hoping all the mothers good health and good luck.
My warm greetings to everybody here today. From the heart that beats for the humanity and dedicating our lives to the noble profession of healing, I, Dr. M. Srishna Devi from Visakhapatnam, Andhra Pradesh, India, specialized in MD anesthesia, at present one of the national directors for Indian Medical Association and State General Secretary for IMA Junior Doctors Network AP. Delighted to bring our national and state teams together to mark the significance on the 7th of April to commemorate World Health Day, celebrating the theme of 2025, Healthy Beginnings, Hopeful Futures, focusing on maternal and newborn health. Empowering the future healthcare, where healthcare is a right, not a privilege, tells our Indian Medical Association as one of the largest and most respected organizations of our country, which plays a role in shaping the medical landscape of our great nation, India. United we stand, united we heal. We, the respected doctors of Andhra Pradesh, unite together to emphasize the importance of World Health Day, sharing our expertise to create an awareness of the theme Healthy Beginnings and Hopeful Futures, focusing on maternal and newborn health. Together, let's work towards a healthier tomorrow. Thank you.
Hello everyone, I'm Dr. Devi, consultant gynecologist in Trust Multispecialty Hospitals. మనందరికీ తెలుసు ఏప్రిల్ 7th ఇస్ ద వరల్డ్ హెల్త్ డే. ఈ ఇయర్ వరల్డ్ హెల్త్ డే మెయిన్ థీమ్ హెల్తీ బిగినింగ్ అండ్ హోప్ఫుల్ ఫ్యూచర్. ఇది మెయిన్ గా ఫోకసింగ్ ఆన్ ఇంప్రూవింగ్ మెటర్నల్ అండ్ న్యూ బార్న్ హెల్త్ కేర్. అసలు మెటర్నల్ అంటే ఏంటి? ఒక ఆడపిల్ల ప్రెగ్నెన్సీ అప్పుడు, చైల్డ్ బర్త్ అప్పుడు అండ్ డెలివరీ తర్వాత పోస్ట్ పార్టం కేర్ తీసుకున్నది మెటర్నల్ హెల్త్ కేర్ అంటాం. న్యూ బార్న్ హెల్త్ కేర్ అంటే డెలివరీ అయిన దగ్గర నుంచి 1 month or 6 weeks లోపు తీసుకున్న బేబీ హెల్త్ కేర్ ని న్యూ బార్న్ హెల్త్ కేర్ అంటాం. అసలు ఈ మెటర్నల్ అండ్ న్యూ బోర్న్ హెల్త్ కేర్ ని ఇండికేట్ చేసే ఫ్యాక్టర్స్ ఏంటి? ఆ ఫ్యాక్టర్స్ మెటర్నల్ మోర్టాలిటీ రేట్. మెటర్నల్ మోర్టాలిటీ రేట్ అంటే డెలివరీ అప్పుడు ఎవరైనా చనిపోయినా దాన్ని మెటర్నల్ మోర్టాలిటీ రేట్ అంటారు. ఇన్ఫాంట్ మోర్టాలిటీ రేట్, పెరినేటల్ మోర్టాలిటీ రేట్ అండ్ చైల్డ్ బర్త్ మోర్టాలిటీ రేట్ అంటే డెలివరీ అప్పుడు కానీ పుట్టిన తర్వాత 48 గంటల్లో కానీ పుట్టిన 1 month లోపు చనిపోయిన పిల్లల వాటి రేట్లని ఇవన్నీ అంటాం. అండ్ మెటర్నల్ మోర్బిడిటీ రేట్. ఇవన్నీ మనం కొన్ని ఫ్యాక్టర్స్ ప్రివెంట్ చేయడం మూలన ఈ మెటర్నల్ అండ్ న్యూ బోర్న్ హెల్త్ కేర్ ని ఇంప్రూవైజ్ చేయొచ్చు. అవేంటి? డ్యూరింగ్ ప్రెగ్నెన్సీ, చైల్డ్ బర్త్ అండ్ పోస్ట్ పార్టం అప్పుడు కేర్ తీసుకోవడం. ప్రెగ్నెన్సీ అప్పుడు యాంటీనేటల్ కేర్ అంటాం. దాన్ని ఏంటంటే మనకి పాజిటివ్ రాగానే హెల్త్ కేర్ వర్కర్ ని కన్సల్ట్ చేయడం, దానికి సంబంధించిన తర్వాత బ్లడ్ టెస్ట్లు, ఐరన్, ఫోలిక్ యాసిడ్, మల్టీవైటమిన్, కాల్షియం సప్లిమెంట్స్ తీసుకోవడం అండ్ ఇమ్యునైజేషన్ షెడ్యూల్ ఫాలో అవడం, న్యూట్రిషన్ షెడ్యూల్ ఫాలో అవడం. దాని తర్వాత ఏవైతే హై రిస్క్ ఫ్యాక్టర్స్ ఉంటాయో ఈ షుగర్, బీపీ, ఈ ఫ్యాక్టర్స్ అన్ని రూల్ అవుట్ చేసుకోవడం. అది యాంటీనేటల్ కేర్. స్కిల్ ఇన్స్టిట్యూషనల్ డెలివరీ ఫాలో అప్ అవ్వాలి. అంటే హోమ్ డెలివరీస్ కాకుండా మనం డెలివరీ మోస్ట్లీ హాస్పిటల్స్ లో చేసుకుంటే మనకి న్యూ బోర్న్ కేర్ బాగుంటుంది. అంటే అక్కడ పీడియాట్రిషియన్స్ అవైలబిలిటీ ఉంటారు, సెప్సిస్ తగ్గుతుంది. దీని మూలన బోత్ మెటర్నల్ మోర్టాలిటీ అండ్ మార్బిడిటీ రేట్ ని డిక్రీజ్ చేయొచ్చు. ఎందుకంటే ఈ మెటర్నల్ హెల్త్ అవుట్కమ్స్ లీడ్స్ టు ద బెటర్ అవుట్కమ్ ఫర్ న్యూ బోర్న్. ఈ యాంటీనేటల్ కేర్ అప్పుడు మంచి కేర్ తీసుకుంటే న్యూ బోర్న్ కేర్ కూడా చాలా బాగుంటది. అండ్ దాని తర్వాత ఎమర్జెన్సీ ఆబ్స్టెటిక్స్ కేర్ కి కన్సల్ట్ అవడం ఏమైనా కాంప్లికేషన్స్ ఉంటే. అండ్ మెయిన్ పోస్ట్ పార్టం. ఈ పోస్ట్ పార్టం లో ఈ ఎవరైతే మదర్స్ ఉన్నారో వాళ్ళకి బ్రెస్ట్ ఫీడింగ్ గురించి చెప్పడం, స్పేసింగ్ గురించి చెప్పడం అండ్ మంచి న్యూట్రిషన్ మీద ప్రొవైడ్ చేయడం, ఈ అన్నిటి మూలన ఉమెన్ లాంగ్ టర్మ్ హెల్త్ అండ్ వెల్ బీయింగ్ డిసైడ్ అవుతుంది. అండ్ నెక్స్ట్ న్యూ బోర్న్ హెల్త్ కేర్. ఈ న్యూ బోర్న్ హెల్త్ కేర్ అంటే మనం పుట్టిన తర్వాత న్యూ బోర్న్స్ ని ఎలాగా ఫీడ్ చేయాలి, వాళ్ళ ఇమ్యునైజేషన్ ఫాలో అప్ అవ్వాలి, ఏమైనా వస్తే వెంటనే డాక్టర్స్ ని కన్సల్ట్ చేయాలి. ఇవన్నీ ఫాలో అప్ అవడం వలన మనం ఈ మెటర్నల్ అండ్ న్యూ బోర్న్ హెల్త్ కేర్ ని ఇంప్రూవైజ్ చేయొచ్చు. So, sincerely hope that you all follow this advice and bring improvisation in maternal and newborn health care.
Good morning, everyone. Happy World Health Day. On this World Health Day 2025, we come together to embrace the powerful theme, healthy beginnings, hopeful futures. A healthy start in life is every child's right and every mother's hope. Yet millions around the world still face preventable risks during pregnancy and childbirth. Today, we are reminded that maternal and newborn health is not just a medical concern. It is a foundation for thriving families, resilient communities, and a healthier future of our world. By ensuring access to skilled birth attendance, timely antenatal care, good nutrition, and safe delivery practices, we not only save lives, we also ignite hope. Yes, hope that every child born is given the best chance to grow, learn, and flourish. Hope that every mother survives to nurture and guide the next generation. Let this day inspire us as healthcare workers, policymakers, and citizens to strengthen our systems, bridge gaps, and reach the unreached. Because when we invest in healthy beginnings, we truly build hopeful futures. Thank you.
I am Dr. Shanti, consultant gynecologist. The World Health Day 2025, the theme is Healthy Beginnings and Hopeful Future, focusing on improvement of maternal and newborn health and survival. So today I want to talk about how to improve maternal and neonatal health. First, let me talk about maternal health. Maternal health first has to improve by promoting early marriages and early pregnancy. So nowadays so many people, because they are marrying after financial stability. So because of their late marriages, mother may develop diabetes, hypertension and other so many medical disorders. So to prevent all these complications, we should promote early marriages and early pregnancy. So apart from this, proper and comprehensive antenatal care is very important. During antenatal care, nutritional counseling is very important. We should promote mother to eat balanced diet with proper fat, fiber and carbohydrate and protein. So this is very, very important. Not only balanced diet, we has to promote proper sleep. So night sleep is very important. In between 10 p.m. to 6 a.m. like circadian rhythm is very important. Because of this night shifts and so many software engineers lack of sleep, they are developing so many complications. Not only sleep and stress is a major role, it is playing major role in so many lives. So to prevent, there has to avoid stress. That is very, very important. Then apart from this, regular normal exercise like yoga, swimming and meditation and walking also is very important. Some people it should be done under doctor's supervision. So not only this antenatal care, but delivery should be conducted by proper trained persons like doctors, nurses, midwives in proper center. So after delivery, postnatal care also is very important. Postnatal care, so we have to promote proper hygiene and breastfeeding. How to breastfeed in proper position, how in between intervals they have to breastfeed. Everything we have to educate them. So after this, proper birth spacing and to prevent unsafe abortions, we should promote proper family planning methods like how they have to use contraceptive pills or barrier methods or copper T or any other contraceptive methods like injectables. So all these things mainly to improve maternal health. Coming to newborn health, immediately after delivery of baby, we should take proper care like delayed clamping of cord and assessing birth, respiration, breathing and breastfeeding is also very important, and we should provide thermal care. We should maintain temperature around baby, and breastfeeding advantages we have to explain to the mother and couple. So how many advantages are there? Breastfeeding promotes immunity in the baby, it prevents infections, it improves digestion capacity of baby, and it improves the bonding between mother and child, it provides thermal care. Like so many advantages are there that all things should explain to the mother and the other attendants. So this is very important. Apart from this breastfeeding, proper regular pediatric visits for vaccination. So proper vaccination is very important. After this vaccination, parents has to observe baby's hearing and vision and the other reflexes like milestones. Milestones means like crawling and smiling and when they are standing, when they are sitting, when they are walking. Everything has to observe by parents. So by taking all these precautions, we can promote maternal and newborn health. Thank you.
I am Dr. Vani Madhavi, Professor of Preventive and Social Medicine. On this occasion of World Health Day 2025, my best wishes to all of you. And this year we came up with a powerful theme, Healthy Beginnings and Hopeful the Futures, focusing on the maternal and newborn health. So in this regard, we need to spread the message regarding the mothercraft. Mothercraft is nothing but the education you are giving to the mother regarding the reproductive health, family planning measures, antenatal, postnatal and intranatal care, and child rearing, nutrition and even family budgeting. That education should be not only to the mothers, every family member should have the minimum knowledge regarding all these things. Then only we can reduce these maternal and newborn deaths. When you take as a whole in India, the average maternal mortality ratio is 97 per 1 lakh live births, and it is highest in Assam, it is around 195, and lowest in Kerala 19, and it is AP 45. Why this variation is because of the lack of the awareness. So that awareness has to be created everywhere, and there should not be any delay in accessing the health services. That is very, very important. So promote this message and bridge the gap, because every pregnancy and childbirth is unique and we need to respect that. On this occasion, thank all your family members and healthcare personnel who is taking care of your health. Thank you.
Hello everyone. I am Dr. Maithili, endocrinologist from Visakhapatnam. The theme Healthy Beginnings and Hopeful Future is indeed the need of the hour. We are aware that maternal nutrition and maternal health determines the health of the offspring. And this is what we call developmental origins of health and disease. This determines the health of the offspring at a later age. And today we are aware that this is the seed of the increasing prevalence of non-communicable diseases in young individuals. So if we talk about primary preventive strategies of non-communicable diseases, obesity, diabetes, cardiovascular disease and cancers, the focus again is on maternal health and the newborn health. Therefore, this theme is a very apt one, a very important theme for all clinicians to focus on preventive strategies, empower women to take charge of their health, focus on the womb, and thereby prevent non-communicable diseases. Thank you.
Namaskar. Myself Dr. Sujit Kumar Mohanty, working as cardiothoracic surgeon, Medicover Hospital, Visakhapatnam. Today, 7th April, we are celebrating World Health Day. This year topic is healthy beginnings and hopeful futures. So this is basically based on maternal and neonatal mortality. Every year there is 3 lakh people are dying because of maternal mortality and 2 million children dying every year. This is very tragic situation. So the theme is to how to improve this condition, safe life for mother and children. I have noted some important point how to improve or decrease the maternal mortality and neonatal mortality. So important points are like prevent early and late marriage. Many poor girls are early marriage, so they have post-delivery complications. Also some people once after stability they will get marriage. That also cause problem with delivery and the fetal problem. Second point is support to the female. Female support first from the husband should be there. They should educated and literacy should be good. And other family members like mother, mother-in-law, brother, they should take care. They should understand the physiological life of the woman and neonate. Third point is nutrition. Nutrition in our society, female are themselves, they neglect their food habit. So they should properly eat in time, sleep properly, so their health status should be improved, particularly during pregnancy and post-delivery. Fourth point, health checkup, which is in city they are doing regularly, but in majority people are staying in our rural area, though PSC are very far away. So the family members should support and do regular checkup in the proper way. And finally, what I'll tell that all the delivery should occur in the hospitals, like even on small primary health center or small hospitals or NGO hospitals like that. As a cardiac surgeon, I saw there is 7% of death due to cardiac related. So people should go the pregnant before marriage. The most common cause of death is due to cardiac related are hypertension or blood pressure. Some undetected cardiac problems like dilated cardiomyopathy, severe MS and severe AS, which are undetected during or even not detected before delivery. So I request all the doctors or the family members of the they should do ECG, X-ray, 2D co, at least before planning for pregnancy or early trimester or first trimester of the pregnancy. So, and the neonate who are delivered or babies, major cause of death is one of the congenital heart disease. So they should check immediately at the level of primary health center or any, as I told, or the private hospital or NGOs. Thank you. I wish all the mothers or women this year this video will help them to make him awareness. Also, other people of family and doctors and societies should agree with me. Namaskar.
My name is Dr. Chalpati. I'm working as gastroenterologist at KIMS Hospital, Visakhapatnam. So today on April 7th, World Health Organization is observing World Health Day. And this year in 2025, the theme is Healthy Beginnings and Hopeful Future, which concentrates on improving health of the children and mothers. So on this eve, in concurrence with the theme of this year of 2025, so let us just talk about the various gastrointestinal and liver problems that can happen in children and mothers. So if you actually see the various gastrointestinal and liver problems that can happen in the mother, there can be suffering with gastrointestinal reflux disease, gallstone disease, jaundice, hepatitis, and various other problems like constipation and diarrhea. The other common problem is gallstone disease. Because of pregnancy, because of hormonal changes, there can be increased formation of gallbladder stones. Patients can have acute severe abdominal pain in the upper abdomen. Get an ultrasound scan and consult your doctor for further treatment. Jaundice and hepatitis, that is infection of the liver, can happen in pregnancy, which is very important to detect and manage because it can affect the mother as well as the baby. So hepatitis can happen because of contaminated food and water. If there is hand-to-hand transmission, hand-to-mouth transmission, if there are unhealthy and unhygienic conditions, viruses like hepatitis A and hepatitis E can affect the liver and can cause jaundice in mothers. So taking appropriate precautions about food and water, cleanliness and hygiene is very important. More important to note is there is a slight risk of liver failure in pregnancy, so don't ignore that. So please consult your doctor. Hepatitis B and C are very easy to manage during pregnancy. There are very effective medications to save the mother as well as to prevent the occurrence of hepatitis B and C in the baby. So consult your doctor, get good medications to control and treat this virus and save yourself. The other common problem is fecal urgency, diarrhea, and constipation. So pregnant ladies can have this uterus which is pressing onto the rectum and intestine and can irritate the intestine, causing diarrhea and urgency of stools, as well as it can cause constipation. So simple dietary habits like adding good fiber, adequately hydrating yourself, doing some kind of good exercises, and avoiding heavy fatty food and artificial sweeteners, junk food, all these things can happen. And it can help, if you avoid all these things, it can help in controlling and treating of your problems. GERD, that is gastroesophageal reflux disease, can happen typically as the pregnancy progresses when the uterus actually moves forward, when it is accommodating the growing baby. It can push on the stomach and can cause reflux. So patients can have heartburn, belchings, regurgitation and reflux of food. There are certain tips. So avoid heavy meals, avoid fatty meals, avoid wearing tight clothes around the abdomen, and don't lie down immediately after the food intake. So eat small quantity of meals, avoid all these sugary beverages, caffeine, carbonated beverages, etc. If you need any medications, consult your doctor. Coming to the babies, a newborn baby is given vaccinations. But if the mother is hepatitis B positive, then the baby needs to get an immunoglobulin for hepatitis B along with the various vaccinations as per the protocol. Jaundice is a frequent problem in babies immediately after birth, but If the jaundice happens immediately after the birth within first 24 hours, or if it is not coming down so easily, then it is a matter of worry. Then please consult your pediatrician, because some jaundice can be because of congenital problems, birth related problems, and don't ignore them. Babies need mother's milk. Breastfeeding is the key for good health for the babies, good development for these babies, as well as to prevent many future long term problems like inflammatory bowel disease, colitis, obesity, and fatty liver. So don't ignore mother's milk, don't ignore breast milk. At least minimum of 6 to 9 months of good mother's milk is very important. Get vaccinated regularly, maintain a vaccine card, and follow the advice of your pediatrician.
Hi everyone, this is Dr. Trimurthulu, Srilasya Hospital, Kakinada. On the occasion of the World Health Day, the theme that is given by the WHO is Healthy Beginnings and Hopeful Futures. So it is a reminder that every mother, every child deserves a safe start in life. But shockingly, every 7 seconds, a mother or a newborn dies from preventable causes. Every year, globally, 3 lakh women die during pregnancy and 7 million babies die within first month of life, which are preventable causes. These are. It's very shocking. It's not the lives that are lost. It's not the numbers, but the futures and the hopes that are lost. The good news is that all these deaths are preventable. With strong systems in place, with timely investment and timely education of the mothers, we can prevent these deaths. It's time in India that we strengthen our primary healthcare centers and community health centers with skilled doctors and skilled technicians and invest more in the infrastructure at the primary level and prevent these deaths. We as healthcare professionals, leaders and citizens must pledge to make a change and prevent these maternal deaths and child deaths so that to have a safe future for all the babies and newborn babies. Thank you.
On this World Health Day, improving the maternal health and the newborn health, we gynecologists advise preconceptional counseling. అంటే ప్రెగ్నెన్సీ ప్లాన్ చేసుకునే ముందే ఒక్కసారి కన్సల్ట్ చేస్తే ద నెసెసరీ ఓవరాల్ హెల్త్ విల్ బి అసెస్డ్ అండ్ ప్రీకన్సెప్షనల్ గా ఫోలిక్ యాసిడ్ విల్ బి గివెన్. ప్రెగ్నెన్సీ వచ్చిన తర్వాత వెన్ యూ బికమ్ ప్రెగ్నెంట్, రెగ్యులర్ యాంటీనేటల్ చెకప్స్ చేయించుకుంటూ, ద రెగ్యులర్ టెస్ట్ అన్ని చేయించుకుంటూ, రెగ్యులర్ స్కాన్స్ అన్ని చేయించుకుంటూ ఉంటే ప్రెగ్నెన్సీ విల్ బి సేఫ్. A safe pregnancy, uncomplicated pregnancy will always give a healthy newborn. After delivery, postnatal ga kuda, ante the breastfeeding stage, exclusive first 6 months of breastfeeding is good for the baby. Kani even in the breastfeeding period also, the mother should take care of herself. Pregnancy ఎంత important, breastfeeding period also is very important. So women should prioritize their health and take care of themselves. Thank you.
Hi everyone, I am Dr. Venkatakrishna Reddy, working as Senior Consultant Radiation Oncologist in Medicover Cancer Institute. And we all know we are celebrating World Health Day on April 7th, and the theme is being focused on maternal and fetal health. And I'm going to talk about two things. The first one is about the cancers which can occur during pregnancy, and cancers do occur during pregnancy, of course rare, but we should be very vigilant by not missing them during pregnancy, because most of the symptoms are getting masked by the pregnancy symptoms also because of the pregnancy changes what we get. So the most common cancers are the breast, melanoma, hematological malignancies, and we all also see choriocarcinomas also. And we should be vigilant in knowing the symptoms and do not ignore it just by saying they are pregnancy symptoms. The other point which I want to make is during pregnancy we should be very vigilant about having radiation for the mother as well as the fetus, because that can cause teratogenic effects. Even an X-ray for the pelvis which has got 1.1 milligray of radiation dose can cause teratogenic effects, especially in the first trimester of the pregnancy. So better to avoid any radiation needed imaging like X-rays or CT scans. Even MRI we can use, but if you use gadolinium also, you still have complications of teratogenicity. So better to avoid these things during pregnancy. Once you are diagnosed in cancer during pregnancy, you should also discuss with your doctor what kind of treatments you have, options. Surgery is of course very safe during pregnancy. Chemotherapy can also be given. Few chemotherapy regimens are very safe. Radiation is mostly avoided until pregnancy is over. With these few things in mind, we can actually be very vigilant early diagnosing early cancers in the maternal health, and coming to fetal teratogenic effects we can avoid by preventing radiation also. Thank you.
The theme on this World Health Day, Healthy Beginnings and Hopeful Future, highlights the importance of investing in maternal and newborn health. I believe if you want to raise a healthy child, it starts even before birth. The first 1,000 days from the conception till 2 years of age plays the most crucial part in your child's future. The 5 important tips to shape your child's future in first 1,000 days. Day 1 starts in the womb, so planning a healthy pregnancy and nutrition during pregnancy shapes your baby's brain and body. 2. Breastfeeding builds immunity and bond. It is the first vaccine and the best food. Complementary feeding at 6 months is very important. Right food, right growth. Vaccination and regular checkups with your pediatrician helps in preventing dreadful diseases. Love, play, and talk with your child. Emotional care is just as important. Invest in your child's first 1,000 days of life and build a healthy future. This is Dr. Srimuki, consultant pediatrician and neonatologist from Ankura Hospitals, Vijayawada.
Today, on occasion of World Health Day, we are emphasizing on a very important topic, that is healthy beginnings and hopeful future, which emphasizes the importance of health of a pregnant woman and a newborn baby. Hi, this is Dr. Pujita, high-risk pregnancy specialist, Ankura Hospital, Vijayawada. Healthy pregnancy begins with a healthy woman. Women should prioritize their health even before planning pregnancy. Choices made before pregnancy have profound impact on the health during pregnancy and newborn health. Hence, here are few tips. Firstly, the couple should maintain a healthy lifestyle which include nutritious diet and exercise. They should avoid harmful substances like alcohol and smoking, as these have a very strong impact on the health during pregnancy and in the newborn. The mother should ensure that she takes folic acid at least 3 months prior to planning pregnancy. Folic acid helps to develop a healthy baby and avoids birth defects. It is important to ensure that the woman enters pregnancy with healthy BMI, normal hemoglobin, blood sugar and thyroid levels, because these have a very big impact on mother and newborn health. Lastly, do not forget the importance of vaccine. Make sure your vaccinations are up to date. Especially make sure you take rubella vaccine before planning pregnancy, as rubella can cause harmful birth defects. Stay informed, stay healthy. Thank you.
I'm Dr. Prashanti, consultant pediatrician at Universal Hospitals. On occasion of World Health Day, I'm delighted that theme for this year is Healthy Beginnings, Hopeful Futures, focusing on maternal and newborn health. This is to highlight the importance of quality care, which is essential during this vulnerable period of life. Are you aware that combining both maternal and neonatal mortality, there is one preventable death which happens every 7 seconds worldwide? This is not acceptable in this era of technology and AI. That's why WHO made it theme for this year. So what is our role as healthcare professionals? Simply kept in one line, raise awareness and spread the message. So who should we raise awareness to? Raise awareness to anyone and everyone involved in the care of mother and newborn baby, be it parents, grandparents, extended families, your healthcare professionals, your colleagues, your nursing staff, support staff, ANMs, midwives, everyone who is involved in the care of mother and newborn baby, right from the antenatal period to the postnatal period. So what should we raise awareness about? I'm focusing on the newborn care here, right from the first contact with the baby, demonstrating kangaroo mother care, initiating breastfeeding, not just initiating, but making sure breastfeeding is continued by regularly checking and educating mother on correct positioning, latching, checking adequacy of breastfeeding, and ensuring that mother becomes confident to breastfeed the baby even after discharge, maintaining optimal temperature, and also educating the family about recognizing early signs of ill health in the baby, like excessive crying, excessive sleepiness, reduced urine output, inadequate feeding, abnormal breathing, abnormal movements. And it's also very important to regularly do follow-up visits for both mother and baby. Mother mainly focusing on her physical and mental health, and also to make sure that she is fed good quality food. For the baby, to ensure baby is gaining weight, there are no other signs of ill health, vaccinations, and also very important to not give any unnecessary medications to baby. Remember, healthy mothers and healthy babies are the foundation of healthy families, leading to healthy communities. Thank you.
Namaste, I'm Dr. Anil Kumar Puduri, an anesthesiologist based in Kakinada. I usually practice obstetric anesthesia cases mostly. On this World Health Day, with the theme Healthy Beginnings and Hopeful Futures, let's talk about something close to our hearts, that is safe motherhood and newborn survival. As an anesthesiologist, we stand at the critical crossroads of maternal and newborn care, especially during labor, cesarean sections, and high-risk obstetric surgeries. As an anesthesiologist, our role doesn't end with giving anesthesia. We always manage pain postoperatively, and we monitor the vitals. We prevent the complications and ensure both mother and baby make it through safely. And every safe delivery requires a teamwork, you know that. And anesthesia is the silent strength and pillar behind it. Whether it is timely spinal anesthesia for a safe C-section or general anesthesia in the emergencies, we ensure the safest possible outcome for both mother and the child. But to build hopeful future, we must also address the systemic gaps by improving access to safe anesthesia, proper monitoring, and training in the maternal critical care, especially in the rural and resource limited settings. So on this World Health Day, let's commit to making every birth safe, because healthy beginnings truly shape healthier tomorrows. On this World Health Day, let's not just take care, let's act. Thank you. Thank you for giving the opportunity.
Hello everyone, myself Dr. Manoj Anavilla, consultant physician, internal medicine, Kamneni Institute of Medical Science. Hope everyone is doing good. Today we are here to discuss about the theme and importance of our World Health Day, which is celebrated on 7th of April every year. So this year, ఈసారి వాళ్ళు తీసుకొచ్చిన థీమ్ ఏంటంటే హెల్దీ బిగినింగ్స్ అండ్ హోప్ఫుల్ ఫ్యూచర్స్. దట్ మీన్స్ ఈసారి వాళ్ళు మన మెటర్నల్ ఫీమేల్స్ని అండ్ ఫీటల్ అవుట్కమ్ని టార్గెట్ చేశారు. ఐ మీన్ లైక్ తల్లి ప్రెగ్నెంట్గా ఉన్నప్పుడు తీసుకునే ఆరోగ్యవంతమైన ఫుడ్ వల్ల రేపొద్దున బిడ్డ ఆరోగ్యవంతంగా బయటకు వస్తారు, లేదా వాళ్ళు అలవాటు చేసుకునే హెల్త్ డైలీ యాక్టివిటీస్ కానీ హెల్తీ యాక్టివిటీస్ కానీ వీటి వల్ల రేపన్ననాడు బిడ్డ ఆరోగ్యవంతంగా పుడతారు అనే థీమ్ మీద వాళ్ళు ఈసారి కండక్ట్ చేస్తున్నారు. సో యాజ్ అ ఫిజిషియన్ నా ఓపీడీకి వచ్చే ప్రెగ్నెంట్ ఫీమేల్స్ అందరూ కూడా చాలా డౌట్స్ తీసుకుని వస్తూ ఉంటారు. అంటే డాక్టర్ గారు అంతకుముందు నాకు బీపీ లేదు, ప్రెగ్నెన్సీలో బీపీ వచ్చిందన్నారు. అండ్ అదే రకంగా నాకు అంతకుముందు షుగర్ లేదు, కానీ ప్రెగ్నెన్సీ టైంలో షుగర్ వచ్చిందని చెప్పారు. నేను ఏం జాగ్రత్తలు తీసుకోవాలి, ఏం చేయాలి? యూజువల్గా ప్రెగ్నెన్సీ ప్లాన్ చేసుకునే ముందే అసలు 1 year ముందు నుంచి కూడా ఎవరైతే ప్లాన్ చేసుకోవాలనుకుంటున్నారో ఫీమేల్స్ అండ్ మేల్స్ వాళ్ళ పార్ట్నర్స్తో సహా ఇద్దరు కూడా హెల్తీ లైఫ్ స్టైల్ అలవాటు చేసుకోవడం చాలా ఇంపార్టెంట్. అంటే ఎక్సర్సైజెస్ చేయటం కానీ, డైట్లో చేంజెస్ చేసుకోవటం కానీ, జంక్ ఫుడ్స్ ఎక్కువగా కన్జ్యూమ్ చేయకుండా ఉండటం కానీ, ఇలాంటివన్నీ ముందుగా చేసుకుని నట్స్ ఎక్కువ కన్జ్యూమ్ చేయటం కానీ, ఇలాంటివన్నీ చేయడం చాలా ఇంపార్టెంట్. దానితో పాటుగానే మన ఫ్యామిలీ హిస్టరీలో షుగర్ కానీ బీపీ లాంటి సమస్యలు ఉంటే ప్రతి చెకప్లోనూ చెక్ చేయించుకోవాలి. లేదు అంటే ఫ్యూచర్లో పుట్టే బేబీకి సరైన టైంలో కంట్రోల్ చేసుకోకపోతే చాలా కాంప్లికేషన్స్ వస్తాయి. ఇదే రకంగా నేను ప్రెగ్నెంట్ ఫీమేల్స్కి ప్రెగ్నెంట్ అయ్యానని తెలిసిన తర్వాత చెప్పి కొన్ని చేంజెస్ ఏంటి అంటే, యూజువల్గా ప్రెగ్నెంట్ ఫీమేల్స్ డైట్ ప్రాపర్గా మెయింటైన్ చేసుకోవాలి. హెల్తీగా గ్రీన్ లీఫీ వెజిటేబుల్స్ ఇవన్నీ తీసుకోవాలి. ప్రాపర్ హైడ్రేషన్ ఉండాలి ఎప్పుడూ కూడా. దానితో పాటుగానే ఎక్సర్సైజెస్ ప్రాపర్గా చేస్తూ ఉండాలి. ఇదే రకంగా వాళ్ళు ఎక్కువగా స్ట్రెస్ మేనేజ్మెంట్ చేసుకోవాలి. ఎలా అంటే బ్రీతింగ్ ఎక్సర్సైజెస్ కానీ, యోగా కానీ ఇట్లాంటివి చేసుకుంటూ. అదే రకంగా వాళ్ళ స్లీప్ యాడిక్వేట్గా ఉండాలి. నిద్ర ఎప్పుడూ కూడా చాలా అవసరం బేబీ హెల్త్కి. అదే రకంగా బేబీ పుట్టిన తర్వాత వాళ్ళ హెల్త్ ఎలాగంటే మేనేజ్ చేయటం అంటే, బేబీకి ఫస్ట్ 6 months కూడా ఎక్స్క్లూజివ్గా బ్రెస్ట్ ఫీడింగ్ ఇవ్వడం అనేది చాలా ఇంపార్టెంట్. అదే రకంగా వ్యాక్సినేషన్ మిస్ చేయకుండా అన్ని వ్యాక్సిన్స్ టైమ్లీ ఇప్పించడం చాలా శ్రేయస్కరం. అంతేకాకుండా పిల్లలకి ప్లే టైంని పెంచాలి. అంటే కొంచెం ఏజ్ వచ్చిన తర్వాత నుంచి కూడా బయటికి తీసుకెళ్ళి ఎర్లీ మార్నింగ్ సన్ రైజ్ అవుతున్నప్పుడు సూర్యుడి కిరణాల మీద పడేలా చేయటం కానీ, ఇవన్నీ చేయటం చాలా ఇంపార్టెంట్. సో ఫైనల్లీ నేను చెప్పదలుచుకున్నది ఏంటంటే, the mother health is so much important that will be carried forwarded to or carried as the health of baby. అంటే తల్లి ఆరోగ్యంగా ఉండి ఆరోగ్యవంతంగా తిని చేస్తే రేపు పొద్దున్న పుట్టబోయే పిల్లలు చాలా ఆరోగ్యవంతంగా పుడతారు. హోప్ యూ హ్యావ్ అండర్స్టూడ్. అండ్ మనం దీంట్లో రేపటి నుంచి ఇవన్నీ ఫాలో అయ్యి మెటర్నల్ అండ్ ఫీటల్ అవుట్కమ్స్లో ఎంతో కొంత హెల్ప్ అవుతాయి నేను చెప్పిన సజెషన్స్ అని కోరుకుంటూ థ్యాంక్ యూ.